Hi, I'm Amy Rodriguez, editor at Aesthetic Medical Practitioner magazine. Today we're joined by Dr. David Kosenko, a cosmetic physician based on the Mornington Peninsula. He's the president of the Cosmetic Physicians Association of Australasia and head of medical and clinical training at Dermocosmetica. With a strong focus on regenerative aesthetics and tissue-based approaches to aging, he combines clinical practice with a commitment to education and advancing standards in aesthetic medicine. Welcome, Dr. Kosenko.
Thank you, Amy. What a pleasure to be here.
Can you start by telling me a little bit about your practice and your treatment philosophy?
Sure. I guess, look, I've got a lot of experience in medicine, a lot more than I care to think about. I was part owner of a general practice for 30 years, which I sold out from about 18 months ago. But I got into aesthetics around 2007, and I started my own practice, Impress Cosmetic Medicine, on the Mornington Peninsula at 2010. And so juggled both aesthetics and general practice up until 2023. And then I was sitting in bed one morning and I saw an ad on LinkedIn for head of clinical training at Dermocosmetica. I've known George for many years there, and I thought, you know what, I'm just going to apply. And so had a chat to George. The next thing I knew, I was out of the general practice role and into the role at Dermocosmetica, and that's what I've been doing ever since, combining 4 days a week with Dermocosmetica as head of clinical training Australia and New Zealand, and 1 day a week in my aesthetic practice.
Wow, I was going to ask, I was very curious about what made you make that step from, full-time medical practice into this role at Dermocosmetica. What was the impetus behind that? Was it really just you saw it and it piqued your interest?
Yeah, look, it was really weird. I mean, I've had an interest in presenting and teaching. I did a lot of teaching in general practice with GP registrars and medical students and nursing students. So I always had that sort of interest anyway. But to be honest, I read the job description. I thought, this sounds like he's talking about me.
Yeah, I love that.
And so I just, bit the bullet. I know, a pretty big step. Everyone sort of thought you're nuts. I mean, you're moving away from something and you've been doing for such a long period of time into something unknown, but it felt right. It just felt like the time was there to take on a new challenge, and it's been a good move. I've really enjoyed it.
Was it daunting at first? Was it like, oh, what have I done? Was it a steep learning? Because I imagine day to day would look very different.
The last 18 months has been a huge learning curve, both because of what the expectations are and what my role is, but also the evolution of the role. It's unusual to have a doctor in a position with a company like Dermocosmetica, even on a global level. So we're both learning as we go along as to how I can contribute to the company the best and how I can contribute to education across the board.
So I imagine your experience running your practice for decades has helped you understand the challenges and opportunities facing clinics today, and that puts you in good stead and almost a unique position as well to help the practitioners you're training.
Sure, yeah. Our general practice had 4 shareholders, and we were very, very active in the management of the practice and the business overall. So literally 30 years of experience in how to run a small business, how to manage staff, how to develop protocols, how to comply with accreditation, regulations, and all of that experience has been invaluable moving into the new role as well.
Right. So I can almost see, is your role in addition to training and structured protocols, but also it would be almost like a mentor to a lot of people starting their own clinics as well and rising up through the ranks?
If I can help people in that way, that's awesome. I really enjoy that sort of responsibility and that sort of opportunity. So, I'm more than happy to give people advice. I mean, there's lots of different ways to run a practice. I've experienced a couple of different ways, but I've also seen what a lot of other people have done over the years, and it's not quite at the beginning of aesthetics in Australia, but very early on. So I've seen a lot of changes over time, and hopefully I can give people advice from my experience and the things I've observed and the people I've spoken to.
So I'm curious, what were the two ways that you had run your practice you mentioned?
So the interesting thing is that the general practice that I was part of was a very big general practice. We had up to 13 doctors. We had 6 or 7 nursing staff, a team of up to 10 receptionists. We had paramedical people working there. So that was actually a really big organisation. I had a lot of experience in how to handle such a big practice. Interestingly, when I started my aesthetic practice, I wanted the exact opposite. It's me and one other person who runs the practice, and that's the way I wanted the practice to be. I'm hands-on with everything I do. So whenever I talk about a product or a technique or piece of equipment, I'm talking from personal experience, and it's also given me a lot of flexibility. I guess in many ways enabled me to do the role I do now with Dermocosmetica, because I can easily close the practice or reorganize my appointments, because really it's just me there. So yeah, I've had a view of both sides, from both a very large, busy practice and also very small, intimate practice as well.
When you reflect on the evolution of aesthetic medicine over these, three odd decades, what shifts do you believe have most fundamentally changed the way we approach the aging face?
It's interesting. There's been a number of major evolutions. Anti-wrinkle injections in the late 90s, particularly in aesthetics, were an absolute breakthrough. And then I guess in the early 2000s, dermal fillers came of age, and people learnt what they could do with filling lines and wrinkles and volumizing the face and trying to correct things that people weren't really happy with. Energy-based devices then gave us some tools where we could stimulate collagen and get some regeneration happening. But in my mind, the most exciting evolution, and really another big leap forward, is the advent of regenerative aesthetics. And to some extent, that's been in evolution over the last 15 or 20 years with biostimulators. But now we're moving into an era where we're getting physiological regeneration. So we're able to get regeneration of collagen and elastin and improvements in the health of the extracellular matrix and the way the cells function within our skin without any inflammatory process. And I think that's really exciting. I think we're just scratching the surface of that at the moment.
So do you think from your perspective we're witnessing, a paradigm shift towards this rather than just an additional tool in the practitioner's toolkit?
I'd like to think so. I think people get stuck in the ways they've always done things, though. So a lot of people have been in the industry for 5, 10, 15 years, and they're used to doing things a certain way. So what we're asking people to do is to think about something entirely differently and approach it from a different perspective. I'm optimistic that people will make that shift, but there is a certain amount of resistance because people do things and it works for them and they're happy with what they're doing. But I don't think it's sustainable in the long term. We all know there's been a drop-off in the use of dermal fillers over the last few years. And I think part of the reason is that people will have dermal fillers for a long period of time, repeatedly over 5 or 10 years. And then they look at themselves and they realize that they don't look like what they used to look like, or they don't like the way things are heading. And so they're stopping. I think regenerative treatments have a fantastic potential to be able to provide essentially lifelong anti-aging and aesthetic treatments. And so I think if we can get people to think about aesthetics from that perspective, it's going to be good for them, it's going to be good for their businesses, but it's also going to be really good for the patients that come and see us.
Yeah.
Because they're not going to look abnormal or artificial or different.
So I want to go back on the term regenerative aesthetics, because we're hearing bioregeneration, bioremodeling. Are they the same? Are they different? These terms.
It's interesting. There's probably no agreed definition for any of these terms. A lot of the terms have been coined by companies that manufacture products, and they do it as a way of explaining what they do. From my perspective, I look at biostimulation as being a process where you create some sort of stimulus in a tissue to create collagen and elastin. And the products that generally fall into that category tend to do so through an inflammatory pathway. It's a foreign material that's injected. In essence, you're stimulating a wound healing response. As we know, when we cut ourselves, our tissue heals, sometimes with scarring, often without, but it's using that inflammatory pathway to get that regenerative process occurring. Bioremodeling is really defined by a more natural way of doing it. It's a physiological process where you're leveraging what the body normally does and trying to stimulate it to produce more collagen and elastin and hyaluronic acid without any inflammation. And the benefit with that is that you improve the health of the tissue as well. So whilst you can look at it superficially and say, yes, I'm getting more collagen with both treatments, one helps with the health and well-being of the tissues and the vitality of the cells. Other is using a wound mechanism to get that collagen stimulation. So there is a difference, I think.
Right. So it's instead of triggering or creating an injury and then the wound healing cascade from that, it's strengthening the actual physiology.
Absolutely, yes.
When we talk about facial aging, we often focus on wrinkles and laxity, but increasingly we're recognizing the role of fat compartment changes. How do you explain the difference between addressing the dermis and supporting adipose tissue?
That's a great question. I think we're recognizing that aging occurs at multiple levels. It occurs at the skin, it occurs at the subcutaneous fatty tissue, it occurs in muscle, it occurs in bone. And one of the concepts I'm trying to get across to people is that our skin isn't just the stuff that wraps us. It's actually a living tissue. You know, people think of bone as being a structure that supports us, but bone is a living tissue as well. And I think if we can think about the skin being the epidermis and the dermis and then a subcutaneous fat and even the muscle beneath it, all as being a continuous layer where you get messaging occurring between all the different layers and it's a living tissue, then I think we're sort of getting on that path where people are going to think about aesthetics in the right way, you know, a regenerative way. Specifically, as we age, our fat cells, the adipocytes, lose their volume. The stem cells can become senescent and inactive, and they can become pro-inflammatory. So as we age, the fat does develop an inflammatory potential, and that can break down the extracellular matrix, which is the nourishing soup where all our cells live, the fat cells and the fibroblasts, the keratinocytes, and even in other tissues, you know, if you're talking about bone or muscle, myocytes and osteocytes. So we don't, as we age, basically it's an inflammatory process to some extent. And I think if you think about it, you know that your skin can become more sensitive or reactive as you age. It can become drier, you get arthritic and you get sore joints. And all of that's part of that aging process. And there is a certain degree of inflammation that occurs there. So ideally you want a product or a treatment that can help to stop that and ideally reverse it.
Right. So then how does the ever-growing dominance now of GLP-1 receptor agonists affect these changes already I mean, the fat is already changing the compartment. So how is this compounding?
Yeah. Everyone's talked about Ozempic face, where people lose volume in the face. And, you know, initially I thought, well, this is just because you've had weight loss. You know, I always say to people, you can either have the body you like or the face you like as you get older. It's hard to have both. If you're lean in the body, you tend to be fairly skeletal in the face. And if you've got a nice, fuller face, you tend to be carrying too much body weight. What's been discovered is GLP-1 receptor agonists actually have a direct effect on adipocytes and fibroblasts. And the reason they do is because those cells have GLP-1 receptors on them. And so the GLP-1 is not only causing weight loss, but it's having direct effect on adipocytes and keratinocytes as well, and fibroblasts. And basically, in a nutshell, they're increasing the number of reactive oxygen species, interfering with glucose metabolism and hence the energy of the cells. And importantly, there's a layer of fat that's directly underneath the dermis called the dermal white adipose tissue. And that layer produces estrogen, which is very important in everyone's skin, but in particular in women's skin, to keep it plump, keep collagen being produced, keep hyaluronic acid being produced. And the GLP-1 receptor agonists reduce the amount of estrogen produced by this layer. So they're accelerating, if you like, a menopause-like effect in women's skin. So what we're seeing when people are on these medications is they're actually getting skin effects as well.
Wow. I mean, hormonal aging is a different, skin aging is a different conversation altogether. So how does menopausal skin aging differ biologically from chronological aging versus GLP-1 aging or changes?
It's interesting because the more you look into this, the more you realize it's all interrelated. With menopause, I think traditionally people have thought about the whole body changes that occur to a female, you know, whether it be flushes or what happens with their weight or with their concentration, the way they can think, or emotional lability or stability. But there are changes that occur within the skin too. You know, everyone's familiar with the fact that the skin changes as you get older, but I don't think anyone really recognised the important role that estrogen plays in keeping a woman's skin plump, hydrated, elastic, firm as they go through the menopause. The withdrawal of estrogen actually has a very dramatic effect on skin, and it leads to about 30% reduction in collagen in the skin in the first 5 years after menopause. GLP-1 receptor agonists unfortunately just don't help it because you're reducing the estrogen even further, perhaps at a younger age.
So is there any way we can bring back some estrogen into our skin?
There is. Look, there's two ways we can address this, I think. One is the regenerative treatments we were talking about before. Some of them will have a very beneficial effect on the adipocytes, the fat cells, and also the fibroblasts within the skin to increase collagen and elastin and hyaluronic acid. But you can also treat the skin topically. I mean, above and beyond, say, hormone replacement therapy that a woman may decide to go on at the time of menopause, there are topical treatments that you can apply that will stimulate the estrogen receptors and have a beneficial effect on the skin.
So Emapel, am I correct in saying, is one of those topical products that is beneficial for estrogen depleted skin?
Yeah, look, in my opinion, Emapel's probably the best product on the market when you're talking about that sort of effect. And the reason is because Emapel contains something called methyl estradiol propionate. Now, despite the name, it is not a hormone. It's a sterile ester. It binds to the estrogen receptor in the skin and stimulates the production of collagen and hyaluronic acid, and hence increases the firmness and hydration elasticity of the skin. But it does so in a way that doesn't have generalized systemic effects, so that none of the MEP that's absorbed into the bloodstream, that is changed into an inactive metabolite immediately. So there are no downstream effects, if you like, from the MEP. So it's a specific skin effect. Facial skin has a very high concentration of estrogen receptors, and so you're putting the product where you need it, and it's giving a localized effect without any downstream effects.
I can see how that would be very advantageous to a lot of people who would want to go down a non-hormonal route for that.
Yeah.
I wanted to go back a little bit about your role as a clinical trainer. As a clinical trainer, what do you wish more clinics knew about this regenerative medicine space, about this, treating as menopause and perimenopause has entered the conversation a lot more loudly in the past few years. I'm sure a lot of patients are coming in wanting to address some of these symptoms as well. So what do you wish more clinics knew about this sector?
This sort of reflects something that I guess I experienced in general practice maybe 25 years ago, and there was a move towards really concentrating on a holistic approach to a problem, not just thinking about what the obvious solution is to fix a particular problem, but looking at a whole body solution, whole person solution, if you like. And what I'd like more clinics and more practitioners to do is to think about aesthetics in that way as well. So it's not just about filling a line or a wrinkle or volumizing. It's more about tissue health and long-term well-being. And, if we can start to develop treatments that can be used in the long term to provide improved skin health and tissue health, whether it be involving the estrogen receptors in the skin or regenerative approaches, I think that it's good for the patient, it's good for business. If you've got something that you can safely do over and over again, and the patient's skin is getting better and healthier as time goes on, they're going to be happy because they're healthier, and you're going to be happy because you don't need to find new people to come and see you all the time. You're going to have this base of patients that keep coming back to you because what you're doing is very useful for them in the long term. So I think what I'd really like to see is people thinking about aesthetics differently, not just about a quick fix, but about a long-term solution.
Right. And also for clinics today, success often depends not just on the treatments, but on how well they understand the science behind them, and they can relay expectations to the patients. And a lot of these all of these regenerative treatments take time as well. It's not like the old instant, filling and volumizing. How does Dermocosmetica, and in your role as well, how do you support clinics through education and ongoing professional development in these types of matters?
We're very active with training and workshops. We've got a great team of trainers all around Australia. We are very active in having attendances at conferences. Usually around the time of conferences, we'll have workshops, and we may even have a bit of a road show where we try to get to most major centres around Australia where we can focus on one particular aspect of things. I guess one of the things that I'm really passionate about is the consultation process. You mentioned that, the regeneration takes time. I think explaining that to people takes time as well. So part of what I'm trying to do when I train people is impress on them the importance of that consultation process. And to me, there's a lot more advantage to me personally when I'm in my clinic through spending half an hour or an hour with someone, talking to them, in essence, educating them about the whole process, which ends up being a marketing process, if you like, if you want to look at it from that perspective, ensuring ongoing custom because they understand what we're doing, rather than just, what do you need today? Okay, here you go, we'll do it, and out the door, and then try and find what the best advertising is to get people in. So training involves really training people about how to interact with their patients and also have a good consultation process.
Right. And taking that extra time in the beginning is going to save you time.
Ultimately. It does. And it builds trust. It builds rapport. People understand where you're coming from, what you're trying to achieve. It's matching the result with the expectation, being able to explain that properly, being able to take the science out of it so you can explain something in lay terms.
Mm-hmm. When you look at the arc of aesthetic medicine over the past, as we said, 20, 30 years, do you feel the growing interest in regenerative medicine reflects the shift towards aligning aesthetics in general more closely with biology rather than working against it, almost as it has in the past with what we were talking about, inducing injuries?
I think it does. I think there's a lot of companies out there that are coming up with great ideas and novel ways of trying to stimulate the body to physiologically deliver the results. There are more products on the market that are aiming to achieve that. It's interesting now being in the industry because you always see the competition between the different manufacturers trying to highlight the unique benefits of their products and why theirs are better. But I think that sort of competition also spurs on further development. If someone comes out with a good idea and they see how they can incorporate it into another product, and it just builds and builds and builds. So I think we are seeing a shift from just a corrective approach to aesthetics to a more long-term regenerative and health-driven approach. And like I said, that whole body or whole person treatment idea is one that really appeals to me, and I hope that's the way it goes down the track.
Yeah, it's exciting times indeed. I feel like right now is you guys are like shaping what's to come with the regenerative treatments you're doing and the products that are being evolved and, trialed, and it's just really exciting to see.
And people are innovative, so once the word gets out there and a product's released, then you find practitioners trying different ways and trying to find if they can improve the way it's being used. So finding combination treatments coming out or people doing off-label things. And, that sort of innovation, and I wouldn't use the word experimentation, because it's not truly experimentation, but, a new way of trying to use a product is often how we make breakthroughs. I mean, that's been in medicine for many, many years. It's nothing unique to aesthetics. But I think that drives the whole system forward too.
Excellent. Well, thank you so much for joining us, Dr. Kosenko, and for your fascinating insights.
Thank you very much for your time, Amy. Thank you for inviting me.